But now we're going to talk about ketamine and how ketamine can potentially enhance cognitive functioning. So the neurological mechanisms of action of ketamine are actually known neurochemically, and the way it induces changes neurochemically likely induce an antidepressant effect. Psychological mechanisms of the action of ketamine have also been proposed, and some of those proposed mechanisms of psychological action may include what we call ego loosening or ego dissolution. This is an important feature of the psychedelic experience. So this process may occur because of changes in the brain from the ketamine in the brain areas that mediate the sense of self. So what does that mean? From ketamine and other psychedelics, there are changes to what we call the default mode network, which is thought to be where the self or self-reference is located. And when we can interrupt this network temporarily through the ketamine and be less self-conscious, we actually lose aspects of the self. So what does that mean? All the aspects of the self that narrow our perspective, like who we think we are, all the thoughts and judgments that go along with that, then become muted. And we have a much broader perspective on our reality. And what results from that is an increased capacity to see various aspects and solutions to problems. What can also result is an increase in creativity, being able to make connections that we would not before because of how we become stuck in our sense of self and all the self perspectives that limit this ability to make connection. So that is why some people call the ketamine experience finding yourself by losing yourself. Ketamine and its ability to modulate neurochemical pathways can induce neuroplasticity. Neuroplasticity promotes cognitive functioning. So therefore, there is emerging research on the potential of ketamine as being what we call pro-cognitive or neuroenhancing. So beyond those psychiatric uses for ketamine being an antidepressant, there is emerging evidence that suggests ketamine may possess neuroprotective effects, which might benefit individuals who are dealing with cognitive difficulties. Why is that? Ketamine might be a cognitive enhancer, both through that direct effect on neuroplasticity, but also the indirect effect of enhancing mood, which we know can negatively impact cognitive functioning. At Acheron, we have a ketamine-assisted cognitive remediation protocol for attention and executive functioning difficulties. In this approach to cognitive remediation, we utilize the insight that becomes derived from ketamine journeys. We also use the neuroplastic effects of ketamine, the mood enhancement effects of ketamine, as well as the priming that we have specifically designed for the ketamine journey to help one recognize their cognitive strengths and thereby help one become empowered to approach and mitigate their deficits. Therefore, we affect change in one's sense of self related to their cognitive difficulties, including ADD and executive dysfunction. So the optimal outcome of CRT, as well as CRT-K, is to increase self-sufficiency in your daily life so that you are the driver and initiator of tasks that are important to you. You will have acquired usable, specific, and practical strategies so that you can use these strategies flexibly and according to your needs, both in between treatment and when you are no longer in treatment. As I said, becoming your own neuropsychologist. You also become aware of what gets in the way of maintaining your attention or completing tasks, and you have strategies to take back that control. All of this can and should lead to leading a more productive life. And to quote the great Yehuda Ben Shea, he's the grandfather of cognitive remediation therapy. Improvements in the cognitive functions are attributable mainly to a generalized improvement in our ability to use executive functions more efficiently. And that's what we do in CRT. So this is just a small note about the neurocognitive services at Acheron. As I said, we do CRT, which involves an intake to get to the root and the history of cognitive dysfunction, and 8 cognitive remediation sessions that are targeted and goal-oriented and achievable in those 8 sessions. CRT-K, which is cognitive remediation facilitated by ketamine. We have 6 preparation sessions that targets one's insight about cognitive dysfunction and integration sessions to integrate that awareness, and 5 additional non-ketamine sessions that work on building strategies and skill-based functioning to help with executive dysfunction and attentional difficulties. In terms of in-network and out-of-network, we take insurance, a couple of insurances, as well as out-of-network packaging, which we provide super bills for. Well, thank you everyone for joining. If I could leave on one last note, it's that executive functioning, including attentional control, these are modifiable functions in our brain. Treatment can help. And I do encourage everyone to kind of think about ways in which they're perfectly capable, they have perfectly achievable goals, but those darn executive functions get in the way. And again, to kind of reframe those attentional difficulties in terms of executive dysfunction. Am I controlling myself in moments where I need to focus my attention, all related to executive functioning? So, if nothing else, that kind of awareness is hopefully helpful. And treatment is all about helping with that awareness and creating strategies around that paradigm. Thank you so much for listening.